Welcome back to our channel, Health Enthusiasts. Today, we're diving into a topic that's crucial for everyone, regardless of age or current health status: safeguarding your brain health against a devastating event. The stroke. Strokes are more common than you might think, affecting nearly 800,000 Americans each year. They can strike suddenly, leaving lasting effects on your physical and cognitive abilities. But here's the empowering part. Many strokes are preventable. In this video, we'll unravel the mysteries surrounding strokes, exploring their causes, risk factors, and the profound impact they can have on your life. But more importantly, we'll equip you with the knowledge and tools to take proactive steps towards stroke prevention. We'll delve into lifestyle changes, medical interventions, and the importance of understanding your body. So, if you're ready to take charge of your brain health and significantly reduce your risk of stroke, stay tuned for essential tips and insights that could change your life. 1. Understanding stroke, causes and effects. A stroke is a medical emergency that occurs when the blood supply to part of your brain is interrupted or reduced. This deprives your brain tissue of essential oxygen and nutrients, causing brain cells to die within minutes. Strokes are often referred to as brain attacks and can have devastating consequences. There are two main types of stroke: ischemic and hemorrhagic. Ischemic strokes, which account for about 87% of all cases, happen when a blood clot blocks or narrows an artery leading to the brain. These clots often form in areas where arteries have been damaged by atherosclerosis, a condition characterized by the buildup of fatty deposits called plaques. When a plaque ruptures, it can trigger the formation of a clot that travels to the brain and causes an ischemic stroke. Hemorrhagic strokes, on the other hand, occur when a weakened blood vessel in the brain ruptures and bleeds. This bleeding can damage brain cells and create pressure within the skull, leading to further complications. High blood pressure is a major risk factor for hemorrhagic strokes, as it weakens blood vessels over time. Other causes include aneurysms, which are bulges in blood vessel walls, and arteriovenous malformations, which are abnormal tangles of blood vessels. Regardless of the type, the effects of a stroke can be severe and life-altering. In the worst cases, strokes can be fatal. Even when strokes are not fatal, they can cause permanent disabilities, such as paralysis on one side of the body, difficulty speaking or understanding language, memory loss, and vision problems. The extent of impairment depends on the location and severity of the stroke, as different areas of the brain control different functions. In addition to the immediate effects, strokes can also increase the risk of developing other health problems, such as dementia, depression, and epilepsy. Stroke survivors may also experience emotional and psychological difficulties as they adjust to the challenges of their new reality. 2. Risk factors for stroke. Several risk factors increase the likelihood of experiencing a stroke. Understanding these risk factors is crucial for taking proactive steps to safeguard your brain health. High blood pressure, also known as hypertension, is the most significant risk factor for stroke. It damages blood vessels over time, making them more susceptible to narrowing, blockage, or rupture. Research indicates that even slightly elevated blood pressure can double or triple your risk of stroke. Heart disease, particularly conditions like atrial fibrillation, is another major contributor to stroke risk. Roth and others, in a seminal study published in Circulation, established a strong link between atrial fibrillation and stroke. This irregular heart rhythm can cause blood to pool in the heart, leading to clot formation and subsequent stroke. Smoking is a well-documented risk factor for stroke. The chemicals in tobacco smoke damage blood vessels, promote clot formation, and thicken blood, all of which increase the likelihood of a stroke. Smokers have a 2 to 4-fold higher risk of stroke compared to non-smokers. High cholesterol levels contribute to the development of atherosclerosis, the buildup of plaque in arteries. This buildup can narrow or block blood flow to the brain, causing an ischemic stroke. Studies have consistently shown a strong association between high cholesterol and stroke risk. Diabetes, a chronic condition characterized by high blood sugar levels, is also a significant risk factor for stroke. It damages blood vessels throughout the body, including those supplying the brain, and increases the risk of clot formation. Research suggests that individuals with diabetes have a 2 to 4-fold higher risk of stroke compared to those without diabetes. It's important to note that some of these risk factors often coexist. For example, people with diabetes are more likely to have high blood pressure and high cholesterol, further compounding their stroke risk. Recognizing and managing these risk factors is essential for maintaining optimal brain health and reducing the likelihood of a stroke. 3. Stroke and aging. Age is an undeniable factor in stroke risk. While strokes can occur at any age, the likelihood increases significantly as we get older, especially after the age of 55. This heightened risk is due to several factors, including the natural aging process and the accumulation of other risk factors over time. As we age, our blood vessels naturally become less elastic and more prone to damage, making them more susceptible to atherosclerosis and the formation of blood clots. Additionally, aging often brings about other health conditions that increase stroke risk, such as high blood pressure, heart disease, and diabetes. These conditions can interact and exacerbate each other, further elevating the risk of stroke. Aging also presents unique challenges for stroke prevention and recovery. Older adults may have multiple chronic conditions that require complex medication regimens, increasing the risk of medication interactions and side effects that could contribute to stroke. Moreover, physical limitations or cognitive decline associated with aging can make it difficult for some individuals to adopt and maintain healthy lifestyle habits that are crucial for stroke prevention. Research has shown that strokes in older adults tend to be more severe and have a higher mortality rate than strokes in younger individuals. Recovery from a stroke can also be more challenging for older adults, as they may experience a slower rate of healing and face greater difficulties regaining lost functions. However, it's important to emphasize that age is not a barrier to stroke prevention or recovery. Studies have shown that adopting healthy lifestyle habits, such as maintaining a healthy weight, engaging in regular physical activity, and eating a balanced diet, can significantly reduce stroke risk in older adults. Additionally, managing existing health conditions and adhering to prescribed medications are crucial for minimizing the risk of stroke. While aging undeniably increases the risk of stroke, it's important to remember that stroke is not an inevitable consequence of getting older. By understanding the unique challenges and adopting proactive measures, older adults can take charge of their brain health and significantly reduce their risk of experiencing a stroke. 4. Managing high blood pressure and cholesterol. Given their significant impact on stroke risk, effectively managing high blood pressure and cholesterol levels is crucial. By taking proactive steps, you can protect your heart and brain health. Controlling blood pressure often involves a combination of lifestyle modifications and, if necessary, medication. Dietary changes, such as reducing sodium intake and increasing potassium-rich foods like fruits and vegetables, can help lower blood pressure. Regular physical activity, even moderate exercise like brisk walking, can also have a positive impact. In some cases, medication may be prescribed to help manage blood pressure effectively. Similarly, managing cholesterol levels requires a multifaceted approach. A heart-healthy diet low in saturated and trans fats and rich in fiber can help lower LDL cholesterol, often referred to as bad cholesterol. Regular exercise and maintaining a healthy weight also contribute to improved cholesterol levels. If lifestyle changes alone are not sufficient, medication may be recommended to achieve optimal cholesterol levels. Regular monitoring of both blood pressure and cholesterol is essential. This involves periodic checkups with your healthcare provider who can assess your numbers and make necessary adjustments to your treatment plan. It's important to follow your doctor's recommendations regarding medication adherence and lifestyle modifications. Remember, managing high blood pressure and cholesterol is an ongoing process. It requires consistent effort and collaboration with your healthcare team. By taking proactive steps to control these risk factors, you can significantly reduce your risk of stroke and safeguard your brain health. Don't hesitate to reach out to your doctor or a qualified healthcare professional if you have any questions or concerns about managing your blood pressure or cholesterol. They can provide personalized guidance and support to help you achieve your health goals. 5. The importance of quitting smoking. If you're a smoker, quitting is undeniably the single most important step you can take to reduce your risk of stroke. The detrimental effects of smoking on your cardiovascular system and brain health are well established, making it a leading cause of preventable strokes. Smoking significantly increases your stroke risk in multiple ways. The chemicals in tobacco smoke damage the lining of your blood vessels, making them more susceptible to atherosclerosis, the buildup of plaque that can lead to blockages. Additionally, smoking thickens your blood and makes it more prone to clotting, increasing the likelihood of an ischemic stroke. Research has shown that smokers have a 2 to 4 times higher risk of stroke compared to non-smokers. Moreover, smoking not only increases the risk of having a first stroke, but it also significantly raises the risk of having another stroke if you've already experienced one. Quitting smoking, however, offers immediate and long-term benefits for your brain health. Within just a few hours of quitting, your blood pressure and heart rate begin to decrease, reducing the strain on your cardiovascular system. Within a year, your risk of coronary heart disease is cut in half. And within 5 to 15 years, your stroke risk can decrease to that of a non-smoker. Quitting smoking isn't easy, but it's definitely possible. Many resources are available to help you on this journey, including smoking cessation programs, counseling, and medications. Nicotine replacement therapy, such as patches, gum, or lozenges, can help manage withdrawal symptoms and cravings. Support groups and online communities can also provide encouragement and practical advice. If you're ready to quit, talk to your doctor about the best approach for you. They can help you create a personalized plan and recommend resources to support your success. Remember, quitting smoking is an investment in your health, especially your brain health. By kicking the habit, you're not only reducing your stroke risk, but you're also improving your overall well-being and increasing your chances of living a longer, healthier life. 6. Managing diabetes for stroke prevention. High blood pressure and high cholesterol are 2 major risk factors for stroke. Fortunately, both can be effectively managed through lifestyle changes, medication, and regular monitoring. Taking control of these conditions is crucial for safeguarding your brain health and reducing your stroke risk. High blood pressure, often called the silent killer, can damage blood vessels over time, making them more susceptible to narrowing, blockage, or rupture. To manage blood pressure, adopt a heart-healthy diet rich in fruits, vegetables, whole grains, and low-fat dairy products. Limit your intake of sodium, saturated fats, and cholesterol. Regular aerobic exercise, such as brisk walking or swimming, can also help lower blood pressure. If lifestyle changes alone aren't enough, your doctor may prescribe medication to help you reach and maintain a healthy blood pressure level. High cholesterol, particularly high levels of LDL cholesterol, often called bad cholesterol, can contribute to the buildup of plaque in your arteries. This buildup can narrow or block blood flow to the brain, leading to a stroke. Similar to managing high blood pressure, a healthy diet low in saturated and trans fats is essential for lowering cholesterol. Regular exercise and maintaining a healthy weight can also have a positive impact. In some cases, cholesterol-lowering medications, such as statins, may be necessary to achieve optimal levels. Regular monitoring of both blood pressure and cholesterol levels is crucial for effective management. Your doctor will recommend how often you should have your levels checked based on your individual risk factors and medical history. It's important to follow their recommendations regarding medication adherence, lifestyle changes, and follow-up appointments. Remember, managing high blood pressure and cholesterol is an ongoing process. It requires a commitment to healthy habits and regular communication with your healthcare provider. By actively managing these conditions, you can significantly reduce your risk of stroke and protect your brain health for years to come. 7. Concrete steps to reduce stroke risk. While the statistics surrounding stroke risk may seem alarming, there's much you can do to take control of your health and reduce your chances of experiencing a stroke. Making positive lifestyle changes and prioritizing regular medical care are key steps in safeguarding your brain health. Eating a balanced diet is a cornerstone of stroke prevention. Focus on incorporating plenty of fruits, vegetables, whole grains, and lean protein into your meals. These nutrient-rich foods provide essential vitamins, minerals, and fiber that support cardiovascular health. Additionally, they help maintain a healthy weight, which is crucial for reducing stroke risk. Limit your intake of saturated and trans fats, cholesterol, sodium, and added sugars, as these can negatively impact your blood pressure and cholesterol levels. Regular physical activity is another powerful tool in your stroke prevention arsenal. Aim for at least 150 minutes of moderate intensity exercise, or 75 minutes of vigorous intensity exercise each week. This could involve activities like brisk walking, swimming, cycling, dancing, or even gardening. Regular exercise helps lower blood pressure, improve cholesterol levels, and maintain a healthy weight, all of which contribute to a healthier heart and a lower risk of stroke. If you smoke, quitting is one of the most important decisions you can make for your overall health and stroke prevention. Smoking damages blood vessels, increases the risk of clot formation, and thickens blood, all of which significantly elevate the risk of stroke. Seek support from smoking cessation programs, counseling, or medications to help you quit successfully. Regular medical checkups are vital for monitoring your health and identifying any potential issues early on. By getting regular checkups, you can track your blood pressure, cholesterol levels, and blood sugar, allowing for timely intervention if any of these factors become problematic. If you have any underlying health conditions like high blood pressure, heart disease, or diabetes, working closely with your healthcare provider to manage them effectively is crucial for minimizing your stroke risk. Remember, prevention is key when it comes to stroke. By adopting healthy lifestyle habits and staying proactive about your health, you can significantly reduce your risk of experiencing a stroke and enjoy a long, healthy life. In this video, we've explored the causes, risk factors, and devastating consequences of strokes. We've delved into the impact of lifestyle choices, aging, and underlying conditions like high blood pressure, cholesterol, and diabetes on stroke risk. But most importantly, we've outlined practical steps you can take to safeguard your brain health and reduce your chances of experiencing a stroke. Remember, stroke prevention is an ongoing journey, not a one-time event. It involves making conscious choices every day to prioritize your well-being. By adopting a healthy lifestyle, managing underlying health conditions, and staying informed about stroke risk factors, you're taking significant strides toward protecting your brain health. Don't wait until it's too late. Take action today. Quit smoking, embrace a balanced diet, get regular exercise, and work closely with your healthcare provider to manage any existing conditions. Your brain is your most valuable asset, and it's worth protecting. By implementing the strategies discussed in this video, you're not only reducing your risk of stroke, but you're also investing in a healthier, happier future. Take charge of your brain health today and enjoy the benefits for years to come. Thank you for watching. See you in the next video. Stay healthy Stay blessed.